One of the talks in the lecture today was on, we think locally, but medications that we give patients or physicians give patients are metabolized differently than if you're 40 years old.
Well, like Valium, you will sometimes prescribe for people if they're so anxious before getting in a dental chair. So what's the impact?
Well, that
there?
is a very good example because as we get older, our functions change. So when you take a drug, it may stay in your system longer. It may not clear your system as readily. Our brain is much more sensitive to the results of these drugs. So if you're 40 years old and you're anxious and we give you a little Valium or a short-acting med for anxiety, it may clear your system in 4 to 6 hours. So we have a driver come in, they come in with you, you do the dental work, you go home and you're very happy. Mm-hmm. What happens with the elderly that may stay in their system 80, 90 plus hours? So a couple days after the dental appointment, one of the concerns, or at least awareness, people should be aware that the risk for things like falls becomes greater. Mm-hmm. So we have to look at pharmacy that we give dentally or the medications that are given through the physician in terms of long-term, how it does affect their medical and dental health. Because the risk factors can be very great. If someone said, where do you start with your dentist? It's communication and listening, right from the very beginning. Mm-hmm. So ideally, you would like to have a patient come in and ask questions. I'll have my patients write down on an index card before they come in their questions. If they think the number of questions is too many for the time allotted, they send me their card. And I'll say, these are great questions. You don't need 15 minutes, you need a half hour. But the communication is what's important. So the health history can be sent to a patient, they can fill it out, I can get it back. That I can make calls to the physician, to family, to healthcare providers before they make that visit. Having older family members, it's a very difficult procedure to pick up a parent, the transportation, getting them upstairs, getting them in the dental chair, taking the x-rays. So one of the things that I like is to have information before they come in. Very, very, very important.
Just let me stop you on that. So if I'm a family member taking my mom or dad, is that something that if the dentist doesn't offer that, do I have the right to encourage the dentist to change the practice?
Oh, absolutely. Because one of the things you want to look at as a patient is that we're treating you. You're not treating us. And that's very important to realize.
A big paradigm shift
there.
Yes,
because if you think they're treating me, you give yourself the freedom and you give yourself permission to ask those questions. If you feel that you're treating the physician or the dentist, then you're not giving yourself permission to ask health questions. So you need to start a visit by saying, this is what I need to address. These are my concerns. You need to share it before you go in or during a dental visit. And then you want to make sure you get your questions answered. One of the things as you get older is that your value sometimes decreases so that you're in quicker and you're out quicker. So it's important to take control of your dental history as well as your medical history. Ask the questions. Make sure he's listening. And if he isn't, find somebody else.